Fabrazyme 35 mg intravenous solution is used to treat Fabry disease, an inherited disorder that causes a buildup of a certain fat substance in the body. If left untreated, this disorder can lead to kidney disease, heart attack, or stroke. This medication works by replacing an enzyme that the body lacks, helping to break down the fat substance and prevent symptoms such as pain in the hands and feet, dark red spots on the skin, decreased ability to sweat, eye cloudiness, stomach/intestinal problems, ringing in the ears, and hearing loss. It is usually given every 2 weeks, and the optimal timing for taking it should be discussed with your healthcare provider. When using Fabrazyme 35 mg intravenous solution for Fabry's disease, it is important to follow your doctor's instructions for administration. This medication is given through a slow injection into a vein every 2 weeks, and it should be administered by a healthcare professional. The dosage is determined based on your medical condition, weight, and how you respond to the treatment. To prevent any possible reactions during the injection, your doctor may prescribe medications such as acetaminophen or antihistamines for you to take before the injection. It's important to carefully follow your doctor's directions for taking all your medications. If you experience any symptoms during the injection, such as chills, flushing, itching, nausea, vomiting, dizziness, numbness/tingling, shortness of breath, headache, or chest/abdominal pain, inform your doctor immediately. Your doctor may pause or slow down the injection, and provide other medications if necessary. In order to get the most benefit from Fabrazyme, it should be used regularly. You may find it helpful to mark your calendar with the dates for each dose. Be sure to inform your doctor if your condition does not improve or if it worsens. Now let's talk about the potential side effects of Fabrazyme. Injection reactions are common and may include pain at the injection site, fever, tiredness, muscle pain, dizziness, or cold symptoms like a runny or stuffy nose and cough. If any of these effects last or get worse, be sure to let your doctor know. It's important to remember that this medication has been prescribed because your doctor believes that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. However, it's important to contact your doctor immediately if you experience any serious side effects, such as swelling in the feet, legs, or hands. While it's rare, a very serious allergic reaction to this drug can occur. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. And as always, if you have any concerns about the side effects of Fabrazyme, don't hesitate to discuss them with your doctor. Before starting Fabrazyme 35 mg intravenous solution for Fabry's disease, make sure to inform your doctor about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions. Also, let your doctor know about any heart problems you may have. Be cautious while taking this medication as it may cause dizziness. Avoid alcohol and marijuana as they can increase dizziness. Refrain from driving or using machinery until you can do so safely. Limit your alcohol intake and speak to your doctor if you are using marijuana. Before undergoing any surgery, inform your doctor about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, consult your doctor before using this medication. When taking Fabrazyme, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medications without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication regimen. If someone takes too much Fabrazyme and experiences severe symptoms such as fainting or difficulty breathing, it is important to seek immediate medical help by calling 911. Alternatively, you can contact a poison control center for assistance. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. During your treatment with Fabrazyme, your healthcare provider may conduct lab or medical tests to monitor your progress. It's important to attend all scheduled medical and lab appointments as recommended. Make sure to take each dose of Fabrazyme 35 mg intravenous solution as prescribed by your doctor. If you happen to miss a dose, be sure to consult with your doctor or pharmacist to create a new dosing schedule. This medication is administered through an intravenous solution in a hospital, clinic, or doctor's office, and it is not meant to be stored at home. It is used for the treatment of Fabry's disease, a metabolic disease that requires enzyme replacement therapy. The recommended dosage and timing of administration will be determined by your healthcare provider based on your individual needs. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.